Hi, my name is Shaquille Grant. This is for online speech class, and the title of my speech is sickle cell anemia, and I'll just be informing the class about the different types of effects that it has on the people, has on everybody. What occurs in among 1 to 2 African Americans? The sickle cell trait. Now, what occurs in 1 out of every 500 of Black Americans? The sickle cell disease. Today we will discuss what sickle cell anemia is and how the sickle cell trait differs and what can be done to help treat the sickle cell disease. Do you know what sickle cell anemia is? The book Sickle Cell by Shirley Mutter speaks on what type of disease sickle cell anemia is and how it is a hereditary type of chronic anemia found in predominantly Black people. This disease developed when the sickle cell anemia is transmitted by both parent to the child. This disease is not contagious at all. Sickle cell are red blood cells that are distorted and are persistent throughout the bloodstream. They have long pointed hemoglobins with crystal-like structures that they can only be seen distorted underneath the microscope. The cells are very long, curved, and pointed, and it resembles a blade-like structure. Hemoglobins are red material-like structures, the same as red blood cells. Their function is to carry oxygen throughout the whole entire body, including the lungs and different cells of the body. Sickle cell was discovered in 1910 by Dr. James Hedrick, a patient that he's seen for years had the same symptoms of sickle cell. The different types of symptoms for sickle cell anemia are paleness in the skin or fingernails and toenails, yellowish color eyes, major headaches, loss of appetite, tiredness, and lack of energy. Many might ask, how does sickle cell trait differ? Or CDC, Center for Disease Control. People who inherit one sickle cell gene and one normal gene of sickle cell have the sickle cell trait. However, the sickle cell trait usually does not show any symptoms of sickle cell anemia at all. Parents with the sickle cell trait have 50% of a chance to give their cell. People with the sickle cell trait usually does not have any symptoms of sickle cell anemia at all. But parents who have the sickle cell trait are 50% most likely to give their children the sickle cell disease, sickle cell anemia. If one parent has the sickle cell trait, they have a 50% chance of giving their child the equal sickle cell trait, or they have a chance of them not receiving any type of trait at all. If both parents carry the sickle cell disease trait, there's a 1 in 4 chance that the child may carry disease. Or on the other hand, if both parents carry the sickle cell disease trait, there's a 25% chance or 1 in 4 that the child may not have any trait or any traces of the sickle cell disease at all. The signs or symptoms of sickle cell anemia may vary from different types of people. Some people might have mild symptoms, while others may have very severe symptoms or are often hospitalized for treatment. Sickle cell anemia is present at birth, but many infants do not show any signs of sickle cell before 4 months of age. The different types of complications are shortness of breath, dizziness, headaches, pale or abnormal skin colors, and yellowness in the eyes. The article Sickle Cell Anemia by David Zeeves is to show how to manage and control the symptoms of sickle cell anemia and to limit the number of crises that it can occur during treatment. Patients need to go through treatment and whether the symptoms are acting up or not. Patients will take folic acid supplements to help treat the red blood cells, making it easier to carry oxygen to the different types of cells throughout the body. The treatments of sickle cell are blood transfusions and pain medications. Hydroxyurea and antibiotics are the different types of medicines that help treat sickle cell anemia patients. Hydroxyurea is a medicine that reduces the number of episodes or different types of painful experiences a sickle cell anemia patient may have. The antibiotics prevent bacteria or infections in children Today we discuss what sickle cell anemia is and how the sickle cell traits may differ from people to people, and the different ways we can help prevent this difficult disease. Sickle cell anemia is a very difficult problem that's going on worldwide. It's mostly and predominantly in the black community. This is why, with every bit of information we see out there, we should take it into account and see what we can do to stop this horrible disease going on to our people. If anybody knows a person that has sickle cell anemia, make sure you tell them to get their treatments daily and show their support that you believe that they can fight the disease right alongside with you, and tell them never to give up on what they have to do in life. Do not let the statistics scare you away from trying to get treatment from this disease, even though it shows that many people may have the same sickle cell trait. However, if you're going to have a child with any type of partner, make sure you discuss and tell them the different type of effects the sickle cell trait has in your family, and make sure they don't have the trait so that your children may not come out with this horrible disease. Thank you for your time. God bless.